Okay, we're all set to go. Um, let's go ahead and get going here. Today, we're going to dig down deeper into the VMSG dashboard, into the kind of the core of the system, which is operational planning. We're going to walk through all the different facets of an operational plan. We're going to go through the pyramid again. We're going to go into detail on each level of the pyramid with some real life examples from public health departments across the nation for what are services and initiatives, what are goals, what are objectives, what are activities, with some, again, real life examples. As we get to the end, we're going to go in and actually enter a plan into your account, so you can see the exact steps that you go through to enter a plan into the system here. And then this is the only session where we will be assigning homework. And the homework is going to be really simple. It's going to be to create your own little operational plan in the training group. I'm going to walk you through the exact process, how to do that. It's very, very simple, and you're only going to be creating about 6 planning elements in there, but it'll get your hands on and it'll develop some questions that you might have. We will have another session after this, usually about a week, give you time to enter your plans in there to actually review those plans. So we're going to go ahead and get started here today. So we'll go past the workforce development guide today and go back and review the operational planning model. So the pyramid model is kind of cool for the operational plan. I'll explain why in a second here. But the nomenclature that you see, we're going to talk a little bit about that as well here. But the standard nomenclature is this. The organization is your health department. Underneath the organization, then you're going to have groups. And groups is basically the structure of your health department plus any of the highest level plans, like the ones you see in the bubbles up here, what FAB calls their 6-pack of plans. Each group then has its own set of services or initiatives. Services are ongoing things. I like to use the example of WIC as a service that is provided by public health, has been around forever and will continue to be there. Initiatives are future programs you're trying to roll out. So maybe there's some things that you're trying to do in the future. You want to put them in and plan for them and then be able to execute those plans. Each service or initiative has a set of high-level goals. Each high-level goal has a set of SMART objectives, and each SMART objective has a set of activities. Now, the nomenclature that you see here that I just read off is probably the most common nomenclature for operational planning. However, it's not cast in concrete. I've seen different versions, and I'm going to introduce you some different versions of the nomenclature here that I've seen from public health departments across the nation. The model is still the same. Everything fits in there the same, but the things get renamed in there. So let's look at some of those examples. So here's one. The top level, what we call services or initiative, they call strategic priorities. Very, very common in your strategic plan, obviously. And then we have goals. What we call objectives, they call strategies. I'm not really sold on that. To me, strategies are how we're going to get somewhere, which would be more like if you flip the objectives and the strategies around, so the strategies became the activities, it makes more sense to me. But again, these are different examples we've seen. Strategic areas, that's a pretty good definition of what the service or initiative is. Then goals, I like the term outcome objectives. The objective is a specific outcome we're trying to achieve. And then here's the strategies to get to the outcome objective. So that's pretty good. Priorities, yeah, not bad. Goals, objectives, and action steps. Action steps is the most common term we see for activities. Priority areas, still good. Goals, again, strategies, probably not, and action steps. Priorities, goals, objectives, strategies, not bad. Strategies at the top. I don't know how I feel about that one. Strategies, strategic objectives. That's probably not too bad because it's a higher level than an objective, hence the goal, and then action steps. Now, just FYI, everybody should have gotten the meeting invitation, and all of the slides are in the meeting invitation in the notes PDF file here. So you've got all this information in there to refer to in the future here. The next thing we're going to do now is we're going to walk down the pyramid and we're going to go through live examples of each level of the pyramid. Now we're going to bypass the organization level because that's just got your health department name in there. That's all there is. So let's talk about groups. Groups are the structure of the health department to start with here. So let's talk about the level 1 group. So groups are level 1 through 10. Let me just kind of give you a quick view of the groups in your department here. So this is your group screen here. Department level is level 1. You can see things like your strategic plan, the FAB 6-pack of plans are level 2s. Level 2s all report to level 1. Then you'll see down here we have the accreditation group. Underneath that, we have the accreditation plan. So the accreditation group is a level 2 reporting to the department. The accreditation plan is a level 3 reporting to the accreditation. The plan is a plan reporting to the accreditation group, which reports to the department. So you can see the different levels. You can go to 10 levels deep in the groups, and nobody's ever got past 5 or 6 to the best of my knowledge here. But let's look at some other examples here. So the department is typically your level 1 group. Underneath that, let's say we have a community health division. That's a division at level 2 reporting to the department at level 1. And then we have WIC, for instance, reporting to community health, which reports to the department. Now, it's very simple to move these things around, by the way. If, in fact, WIC got promoted, let's say, to be a department level group, then what you can do is you can change what we call the parent group. In this case, the parent group is now community health. You change it to department, and then you change the level from a level 3 to a level 2, and poof, it's up there at the department level. The highest level plans, your Fab 6 packet plans, are typically independent groups. So your strategic plan is a group within itself. It's level 2, as you can see, reporting to the department. Your CHIP, same thing. It's going to typically be a level 2 group reporting to the department. Today, we're going to work on the same example we did in the overview, the Tobacco 2024 group. So the Tobacco 2024 group will be a group within itself here. Now, under the groups, we have services or initiatives. Again, services are ongoing, initiatives are future, and that's really the only difference. Here's some real examples. Healthy moms and babies as a service or initiative. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence. Chronic disease prevention and control. Health disparities. And then again, we're going to use the example of tobacco cessation. So I like to call the services or initiatives containers. It's a container for the plans that will get you to that level here. Underneath services or initiatives, we have what we call the high-level goals. The high-level goals are exactly that. It's a definition of what we're trying to accomplish without the detail. So here's some examples. Reduce the risk of infectious disease. And you'll find the form of a goal is typically action verb followed by a few words. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas. Reduce the risk of vaccine preventable diseases. Promote public health readiness and response. Promote succession planning and career growth. Integrate a data-driven best practices approach. And then we're going to use the example again, reduce smoking in high schools. So when I come to you and I say we're going to reduce smoking in high schools, everybody understands what that means. What it doesn't tell you is where are we going to start, which high schools? How much can we reduce smoking in high schools? By when are we going to accomplish this? So the high-level goal gives you the idea. The SMART objectives is where we get down to the details. Now, if you Google SMART again, our nomenclature is specific, measurable, attainable, realistic, or relevant, and time-based. You're going to get 100 different definitions if you Google it. So, whatever you think, I'm just trying to give you our examples here. So here's some SMART objectives. When I show you these SMART objectives, try to pick out specifically the measurement and the time-based. So specific, measurable, and time-based are the things we focus on. So by December 2024, identify 2 or more strategies to collaboratively reduce risky alcohol-related behavior. So the specific is strategies to collaboratively reduce risky alcohol-related behaviors. Our measurement is 2 or more, and our time frame is obviously by December 2024. Here's another one. By December 2024, 80% of educators and school staff have been exposed to ACE awareness education. By June of 2024, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported on within a VMSG dashboard. And then our example for today, reduce smoking at Wayne High School by 25% by the end of the school year. So I think you can see in each of these, they're specific, they're measurable, and there's a time based. Now the other two, if they're not, never mind. we kind of keep the A and the R out of there because if they're not available, then why go after them here? My brain is a little bit foggy today. I apologize. Okay, so under the SMART objectives, then we're going to have activities. Activities come in three flavors here. The first one we're going to call a project-based activity. So our project-based activity is exactly that. It's a project, something we're going to accomplish in a given time frame here. So here's our project-based activity. Create training content and materials for students and faculty on the dangers of smoking. So you think about that, we're going to create some PowerPoints, some videos, some user guides, that sort of thing. So it's a project that we're going to complete in a given time frame. And our performance measure is going to be, how do we know when we've successfully completed the activity here? So if we're creating the content, once we've created the content, we're done with the activity. Sometimes it's obvious, sometimes it's not so obvious. So we always put a performance metric or performance measure in there. We are going to have a beginning and ending date on a project-based activity. We're going to do team assignments. So we're going to assign a team lead and team members and potentially external partners if you're working with external partners. We're going to go through this in great detail because we're actually going to enter this plan into the system, and you'll see all the different details that we can enter into there. Our measurement in this case is going to be simple, percent complete. So how far along are we in creating the training content? Basically 0 to 100%. So that's our project-based activity. Our next activity we're going to call a quality assurance activity. The QA activity here is provide 9 training sessions each month on the dangers of smoking to students and faculty. So the QA activity is unique in 2 things. Number one, it's cyclical. So we're going to set a frequency. In this case, we've set it to monthly. The frequency can be anywhere between weekly and every 5 years. So in a given month, we're going to provide 9 training sessions. The other thing we do with this particular type of activity is we automatically set the traffic light based on the values we provide here. So we're going to say, we're going to set the light to green if we get to 9 training sessions during the month. And then if we only get to 6, we've just kind of picked that number randomly. If we only get to 6 training sessions, then we're going to call it a red light. And then you can imagine 7 or 8 would be yellow in between there. Instead of a beginning and ending date, we're going to have a cycle start date and a frequency. So our frequency we set to monthly. So if the beginning date is May 1, 24, then the ending date is going to be the end of May of 24. And then we're automatically going to move into the next month, June 1 through June 30th, et cetera here. I'll show you how all that works. Our performance measure, in this case, is going to be created for you. Training sessions provided, measured monthly, and our green, yellow, and red values. And then again, we're going to do team and partner assignments. And our measurement is going to be simple. How many training sessions did we provide? So that's activity number 2, our QA activity. Activity number 3 is our quantitative measurement activity. Quantitative measurement activity is very, very similar to the project-based activity, with the exception that we have a target quantity. So in this case, we're going to contact all 20 tobacco vendors within 1 mile of Wayne High School to ensure they're not selling to minors. Our target quantity obviously is 20 in there. So you can imagine it's pretty simple to measure. So if we did 10 out of 20, we're 50% done. If we did 20 out of 20, we're 100% done. We're going to have beginning and ending dates on this particular activity, just like we did on the project-based activity. Our performance measure, again, will be kind of developed for you. I'll show you how that happens. 20 tobacco vendors contacted between May 1 and June 30th tells us that we're complete. And then again, we're going to do team and partner assignments. And as you can imagine, our measurement is pretty simple. How many vendors did we contact? So those are the 3 activities that will get us to the objective, we believe. Now I'm going to show you this same plan that we just went through in kind of a bullet form here. So our group was tobacco programs for 2024. The initiative we're working on was tobacco cessation. Underneath that, we had one of the goals of reduce smoking in high schools. Under that goal, we had a SMART objective of reduce smoking at Wayne High School by 25% by the end of the school year. And then we have the activities. We're going to create the training content, we're going to provide training sessions, and we're going to contact the tobacco vendors. So this is just a single segment of the plan. The plan can replicate at any level. You can have multiple services or initiatives. You'll see that. You can have multiple goals. So, for instance, we might have a goal that's reduce smoking in colleges. And then under that, we would have a similar objective, in this case, reduce smoking at Wright State University by 25% by the end of the school year. And then you can imagine we'd have a similar set of activities underneath there to get to that SMART objective. So this is kind of what the plan looks like in a bullet form. Now, another document that is attached to your meeting invitation is this operational plan template. It was actually created by one of our clients in Wisconsin years ago. And what it is just the ability to create an operational plan. It's a Word document. Create an operational plan in a Word document with a little bit of kind of feedback in there. You can build it out, you can modify it, you can edit it before you actually enter it in the system. So a couple things. We're going to walk through this document. It's really pretty cool. It's really nice to, if you're not familiar with the system yet, to start out this way. And then we're going to use this exact document to enter the plan in the system so you don't have to sit and watch me type for the next half an hour here. A couple nice things about this template. When we got up here, we have our service or initiative. And it gives you a quick definition. What bucket of work or priority does this relate to? So that's a pretty good definition. Tobacco cessation. Our first goal, what is your pie in the sky? What's your high level goal? Reduce smoking in high schools. Our SMART objectives, specifically, what and when do you hope to accomplish? The objective lead is the person who's going to lead the charge here. Then you have the activities. What are the steps you will do to accomplish the objective? Each activity's got a performance metric. How will I know when I've successfully completed the activity? Our activity leads are the people who are actually doing the activity and leading the team who's doing the activity here. So who's primarily responsible to do and update the activity? And then we're going to have our dates and such over there. So this is the operational plan template. I'm going to go back now and grab that template here. So this is the real Word version of it. And again, you have a copy of this without the tobacco cessation plan in it, so you can use it. You can take any one of these are just tables in here. You can take those tables, you can copy it, put it onto a new page so you can have multiple pages, multiple service initiatives, whatever you want to do with it in here. So what we're going to do now is we're going to take this operational plan and we're going to put it into your dashboard. So let me go back to your dashboard. Down at the bottom of the dashboard, you'll see there's a training group. And then under the training group, there's a Tobacco 2024 group. So these are the training group. You can notice that the training group is a level 1 reporting to itself. So it's kind of out of the flow here. But this is where I'd like you guys to go in and enter your operational plans. And I'll walk you through that in a minute here. But let's go ahead and enter the tobacco plan in here. So I'm going to select the Tobacco 2024 group. I'm going to go down to the services and initiatives. By selecting the group, the services and initiatives are specifically for that group. So when I click on it, you'll see there's nothing in here. To add my first service in here, I can either click on this big plus button down here. What this does is block you from entering anything until you add a new record in there. So I've either got this little plus button over here, the blue one, or I've got the big one. So I'll click on the big one. Let's go back to our template, and I'm just going to copy and paste. So I'm going to grab tobacco cessation. I personally prefer keyboard shortcuts. I can right click and copy, or I can hit Control C on my keyboard, which is copy. Go back over to here. Control V, by the way, is paste. So I'm just going to paste it in there. And we're going to call this an initiative. So I'm just going to check this little box here. This is really the only difference as you're setting up a plan between a service and initiative. Down the road, you're going to see different nomenclature in the reports and things along that line. But here's where you determine this is a future program. And then in order, now that I've entered the data in here, I've got to go ahead and save it. So I click the Save button here, and you'll see it appears up here. So now, by selecting tobacco cessation and going down to the next level, the goals, again, I'm looking at the goals specifically for tobacco cessation. So we're going to go down there. I'm going to go back and grab our first goal here. Reduce smoking in high schools. Again, Control C to copy it. Go back over here. Click the big button again. Control V to paste it in there. Save that. Now, at this point in time, we could change the traffic light. Typically, if it's an initiative, it's something in the future, you haven't had time to get behind schedule, so it's going to be probably staying the same here. You do have choices here. Again, green is everything's moving along as expected. Yellow is something that slowed us down. Red is something brought us to a screeching halt. And gold is successful completion of this portion of the plan. So for now, we're just going to go ahead and leave reduce smoking in high schools in there. Now, we had a couple other goals. So I'll scroll down and grab those. We got, again, reduce smoking in colleges we talked about. Control C, go back here. Now to add a new goal, I'm going to hit the plus button. It opens up the field down here. You can see Control V, save that. And I believe we have one more. Reduce smoking in public areas. I'll grab that. Control C. Go back over to here. Hit the plus button again. Control V. Save it. So we have our 3 goals. Now, a couple things you can do. To go back to the reduce smoking in high schools where we're working today, I can click on that, and then I can go to objectives. Or I can use what we call this drill down arrow. The drill down arrow does both of those things in one mouse click. So it's just saving you a mouse click. So if I click on this, it's going to select reduce smoking in high schools and take me to the objective screen for that. There we are. I'll go ahead and open that up again down here, go back and scroll back to the top, and we'll grab our first objective, reduce smoking at Wayne High School. So I'll highlight that, Control C, go back over here, Control V, I'll put that in there, go ahead and save it. Now, the next thing we're going to want to do probably is add the objective lead. Again, the objective lead is the person responsible for getting us to that 25% reduction by the end of the school year and updating the status down here. So let's go ahead and select our objective lead. I hit the drop down arrow. Now, the reason nobody shows up in here is because it's looking within the current group. Current group is Tobacco 2024. It's a test group. Nobody's assigned to the group. So I'll say show all users. So I'm going to go up here and I'll just go ahead and pick Maria as our lead here, save that so you can see that her name shows up in there. Again, I'll go ahead and save it. Anytime you make a change to anything in the blue down here, which is, by the way, on your local computer, until you hit the save button shoves it up into the server in a fraction of a millisecond. So it's a very effective way to do multi-user computing. The next thing we're going to want to do is say, kind of where are we at this point in time? So I'm going to say we're at 20% reduction. Just randomly pick that number in here. Again, I can go ahead and save that. Now, anytime I update this field down here on a activity or an objective that does not automatically change the traffic light, it asks you, do you want to change the traffic light? I'll go ahead and say okay. And the fact is we're at 20% out of a 25% target. I'm going to go ahead and change that to yellow, saying we're a little bit slow here. The other thing and I'll go ahead and save it. You'll see that the light up here will turn yellow. Now, the notes and comments field is really nice. What you want to be able to do with this is anytime you make a change, like I set this light to yellow, I changed the field down here, whatever it is, I want to put a note in there. You got a couple of choices. You can either just type the note in there, or you can preface it with a time and date stamp. So it's got the date, the time, and the person. In this case, system admin would be Fred Erickson in this particular case. I'm just going to say only at 20%. And I'll go ahead and save that. So what we're doing at this point in time is you're going to put a time and date stamp note in here. So anybody else looking at this will be able to go in there and look at that and say, oh, I see why Fred set the light to yellow. It's because we're only at 20% reduction, something along that line. The other thing you'll see at the goal, objective, and activity level is this data source. The data source is, where am I going to go to get the information I need to update this particular objective here? Let's say we can get that off the CDC Smoking Cessation Fast Facts webpage. So to set the data source, I just click on this field here. It gives me this dialog box. I'm going to say CDC. Okay, so there is actually that web page. I don't know the actual link to it at this point in time, so I'm just going to go ahead and put in http://www.cdc.gov. Okay, so this is the actual link. Now, when you do put in a link, it can be anywhere on your intranet, it can be on the internet, it can be on your file servers, but you do have to preface it with something like HTTP, HTTPS, FTP. There's lots of different things. If you have issues on things within your firewall, if you will, on your intranet, talk to your IT folks. They'll be able to help you to determine what this link would be. If you do have a link to go to this website, for instance, what you might do is go to the website in another browser tab, go up here and grab the link in the link field up here, and then just copy and paste it down into here. I'm going to go ahead and hit OK. So now you see the definition down here in the source field, and then this little link button appears over here. I'm going to go ahead and save it again. Okay, now the link button is going to open up a new browser window or new browser tab and take me right to the CDC webpage here. So the idea is that if you have a place you can go to get the information to fill in that particular objective, why not have it at your fingertips? And again, you'll have this at the goal, objective, and activity level. So you've got different links that you can put in there. So this is our SMART objective. Now, to get to the SMART objective, we know what we want to accomplish, but at this point in time, we don't know how we're going to get there. We're going to go down to the activity level. So let's go ahead and open it up and grab our first activity, which was a project-based activity. You notice I marked them here, project-based, QA, QM. I'm going to go ahead and grab this activity, create the training content. Control C, go back over here, paste it in here, Control V. Now, again, and by the way, this is how you assign the different types of activities. So in this case, it's a project-based activity. We'll just leave it there. You could select QA or QM, leave it project-based. The project-based activity is the only one that you manually come up with a performance metric. So what you're trying to say is, how will I know when I've successfully completed this activity? And we'll go back here and say, because the training content material has been created, Control C, paste it in here, Control V. Okay, next thing we're going to do is assign beginning and ending dates. So you got two choices. You can either just type in the date, or you can use a little calendar drop down. I'm going to go ahead and say January 1 through January 31st here. I'll go ahead and save that. So now what we have is the activity, the performance metric, when we're going to accomplish that activity. And there we go. Okay. Anytime, again, you got the notes and comments field. We got the time and date stamp button over here. This is our current status in here. Now, the project-based activity is a little bit unique in that if you get to 100% complete, it's going to set this light to green here. But we'll talk about that here in a second. Now, the next thing we're going to want to do is assign a team of people here. So I'm going to click on this little button here. And the reason, again, nobody shows up is because we're within the tobacco group. I'm going to clear the group filter by hitting any one of these three little black X's up here. Hit that one, and it just kind of gives me everybody. So you got three choices here. You got team member, team lead, and email notification. If I pick, let's say I'll pick Chelsea as the team lead here. Now, when I do that, it automatically makes her a team member. She's got to be a team member to be the lead. And by default, she's going to be the email notification. The email notification is for that real-time planning email. So she's going to get an email on whatever basis you select, typically monthly, to go back into the system. It'll have a link back into the system, and she'll be able to update this particular activity. Back when we assign Maria at the objective level, she's going to have the same thing. She automatically gets that email because she's the only one assigned. So we have that. Let's go ahead and assign, Kelly Erickson. Must be family. Okay. So we got Kelly, and we'll go ahead and assign Megan here as team members. So we got three team members. We got Chelsea as the team lead and the email notification. I'll go ahead and save that. And here they appear down here. So the L indicates lead, T is team member, and the blue around the L indicates the email notification. So you don't have to go into that screen to look at it. You can look at it and say, oh, I see who everybody in there is. Okay, the next thing we're going to do is if we have any external partners, I don't think you guys have put any partners in yet, but you can click on here. On the left side, you're going to have a list of partners. You may recall on the intro, we had a couple of partners in there. We had VMSG Dashboard as a partner, and then under VMSG Dashboard, we had Fred Erickson as a contact. So as you're developing the partner list, you're going to have all your external partner organizations down here. Each organization can have as many contacts as you want. So you can have the people in the organization. So you're going to select either an organization or an organization and a couple of one or more contacts within the organization. You can have as many partner organizations and as many contacts per organization assigned as you want to. In this case, since we don't have anybody, we just won't assign them here. So that is the activity as it is now. Now, if I go ahead and say, okay, we have completed the training content, mark this as 100%. You notice the light here returns to gold over here. When I save it, traffic light's already set. So and in this case, this is the only automatic traffic light for a project-based activity. So when you get to 100%, it turns the light to gold up here. You can see down here, we have that same data source field. So if I had a data source that I needed to put in there, I can put that in there as well. A couple of options on a project-based activity. 0 to 100% is the default measurement. This little guy is the activity wizard, and it's a little bit different for each type of activity. But for a project-based activity, when I select it, I can put in the beginning and ending date here or here, either one, the same thing. But I do have a couple of data entry types. The default is 0 to 100%, which is, kind of nice if you're moving through a project like this where it's going to take you a month to create it. You say, hey, I'm halfway through, 50% done. But you could also just say, I'm going to do this in the week, and Friday I just want to go in and mark it as complete. So I can use this one. Or I could say yes, no. Yes, no, meaning that I have an activity that is defined as a question. Have you completed the training content? Then I could just have a yes, no. I'm going to go ahead and mark it as complete. And when I do that, complete is equal to 100%. And when it's checked, when it's unchecked, it's 0%. So that's the only two options you have. Again, if you got something that's just going to be done or not done, you can mark it as complete. I'll go back and mark it as our 0 to 100% here. Save that. Go ahead and save our activity again. So that is activity number 1, and those are all the different options that you can utilize for a project-based activity. Next thing we're going to do is add a new activity. So hit the plus button here, clears everything out. Go back here. I'm going to grab our QA activity. So we're going to provide the 9 training sessions. Control C, go back over here, paste it in here, Control V. Now, at this point in time, I'm going to select the type of activity as a quality assurance activity, and you'll notice it opens up the wizard for you automatically here. So the first thing we're going to select is how often, the frequency. And you can see it goes anywhere between weekly and every 5 years. We're going to say monthly at this point in time. Our start date, let's go ahead and move that back to January 1. And here's the values that are going to set the traffic lights. So if it's greater than or equal to 9, we picked, it's going to be green. And if it's less than or equal to 6, we'll pick, it's going to be red. And then you can see if it's greater than 6 and less than 9, or 7 and 8, obviously, it's going to be yellow in there. In this case, we're going to put in a metric type. In this case, it's going to be training sessions provided. And you'll see that when I save that, it builds the performance metric for you. Training sessions provided, measured monthly, green, yellow, and red. I'll go ahead and save that. Now, as we talked about, the traffic light is red because the actual data value right now is empty or 0. If I were to go to, say, we're 8 at that point in time and click on it, you'll see the traffic light turn to yellow over here. Once I saved it, it's going to go up here. You're also going to get this dialog anytime you save this particular type of activity. Because it's a cyclical process here, it's going to say, do you want to update the cycle start date? So you got a couple choices. You can say, no, I'm going to leave it at January 1. I'm not done yet. I'm only at 8 training sessions. Or I can say, yeah, that's all I'm going to get done this month. I can say, pick today's date, which is the 15th or something. I can go ahead and pick today's date, or I can say select. Select is kind of the most common option. It's by default going to pick the beginning of the next month. So it took and added, 31 days or whatever to the date in here. So it's 2/1 of 25. I'll go ahead and say, okay. You're going to see the cycle start date changes to 2/1/25. So what that does is kind of automate the process to move you into the next monthly cycle here. Now, again, on this particular activity, you've got the options of adding the team leaders and team members and activity partners. Let's go through some of the wizard options here. I'm going to talk about this timeline at the very end here. It's a new addition we made to this activity, which is pretty cool, and I want to show it to you. But at this point in time, we've got these values set. Now, some things are better small than big, like a golf score. So the lower the better. So if I wanted to make this let's say less than 3 is green and greater than 6 is red. I click on the less than or the greater than or equal to. You'll notice it switches to less than or equal to. It sets these back to 0. So I'm going to say less than 3 is green and greater than 6 is red. So I can have it either way. You just click on either one of these little buttons here and it flips them around in there. We'll go ahead and flip that back and go ahead. And by the way, the reason it clears them is because you can't have the higher and lower values in the wrong places here. So it doesn't allow you to do that here. So we'll go ahead and save that. We'll go ahead and save that activity again. We'll just say no on selecting the new date. Okay, so that's activity number 2 is our QA activity. And those are kind of all the options that are in there. The next thing we're going to go through, we're going to add a new one here. Go back to our template here. We're going to grab the contact all 20 tobacco vendors, Control C, go in here, Control V. And again, this is going to hit the drop down as a QM activity. Select that. So here we can add the beginning and ending dates. So let's go ahead and use the same dates we've been using, January 1 through January 31st. Our target number we know is 20, so we'll put that in there. Decimal or dollars. Decimal is anything you're counting other than dollars, I guess. You can use this though to manage dollars. So you can have an activity that says, we're going to spend dollars out of this grant in here, and then you can see how many dollars have we spent or how many dollars we have left or whatever you want to measure in there. But in this case, we're measuring tobacco vendors, so we're going to call it decimal. Again, we're going to put in a metric type. In this case, it's tobacco vendors contacted. A couple of options down here. Enter a new value to add to total is the default, or enter a new total value. So let's start with this one. I'll save it. First of all, it's going to build our performance metric. We'll know we're done when 20 tobacco vendors have been contacted between 1/1 and 1/31/25. Now, the add to total is down here. Let me go ahead and save this first. So the add to total field you'll see here is going to allow me to put in a value. Let's say this week I contacted 5. So when I click off of it, it rolls it down to my rolling total of 5, calculates the percent done to be 25%. So 5 out of 20 is 25%. So I can go ahead and save that. I'm going to leave the traffic light as it is. Now the next week I might go in and enter another 5. So I put in another 5. It does the running total to be 10, calculates to be 50%. So that's what that value is all about. Go ahead and save that. Now, if I wanted to just have a one-time total, so at the end of the week I'm going to go in and do it, I can say enter a new total value. You notice the roll-up field goes away. The current total goes up to the actual value field. Percent stays the same in here. So now if I go in here, I can just say, 20, and we're done. So it calculates to be 100%. We say we're done with that. Okay. Now we'll go back here, got to enter a new value to add to total. And that is pretty much the QM activity. Again, one more thing I want to show you. We added a function a while back. If you don't have a target number, you just want to know how many did we do. So how many vaccinations did we do? How many medications did we distribute? How many car seats did we install? How many tobacco vendors are there? You just make it a 0 target. So by making it a 0 target and saving it, you notice the calculation for percent goes away. The reason is you don't have a denominator. You can't divide by 0, so it's just going to count up. So at this point in time, I'm just going to say if I do another 5, if I do 5, add it up in there, it says we're at 25. So it's all we're doing at this point is counting. If you have something that you just want to know at the end of the month how many we do, or the end of the year, whatever it is, you can just do counting in there. Let's go back and set that back to where it was here. Target number of 20. And we'll save that. And you notice the calculation comes back and it's 125%. Okay, so those are the 3 activities and all the different variations of the activities in here. Let's go back and look at that in the pyramid. Oops, get the right place here. Okay, so back in the pyramid, it looks like this. So our group was Tobacco 2024. Our initiative was tobacco cessation. Our goal was to reduce smoking in high school. Our objective was to reduce smoking at Wayne High School by 25% by the end of the school year. And then the 3 activities: create training curriculum, provide 9 training sessions a month, contact the local tobacco vendors. So that is the operational planning model. That is an operational plan in the system. I want to show you one other type of activity here. And that is, get back to where I'm supposed to be here. These are the 3 activities for this plan. I'm going to add a 4th activity that has nothing to do with this plan, but I want to show you that timeline activity and what it's all about here. So I'm going to go ahead and hit the plus button again here. I'm going to say update SOP, standard operating procedure 1. So update SOP 1 each fiscal year. I'm going to call that a quality assurance activity. I'm going to set my frequency to annual. I'm going to set my beginning date to, we'll just fiscal year. Let's go ahead and go back to July 1 would be typically the fiscal year, July 1. This time I'm going to select timeline. Now you see what happens. All the other fields disappear and we just have the timeline field. Percent to yellow. So what I'm saying is I have an annual cycle and I'm going to go ahead and say 90% to yellow. So what happens is as we're going through the year, when we get 90% of the way through the year, the light is going to turn yellow and we're going to say update SOP. So I'm going to go ahead and save that. So update SOP measured annually. The light's going to stay green as long as we're less than 90% of the way through the year. We get to between 90 and 100%, it's going to turn yellow. We get to 100%, it's going to turn red. I'll go ahead and save that. So we're going to go ahead and we're going to assign, after it saves, we're going to go ahead and assign another team member here. Let's go down and assign Jen to this one here. So we're going to have Jen as the team lead. Now, the next thing we're going to want to do is probably attach SOP document here. So here's document management. This is on pretty much every screen. Real simple. Click on that. You're going to click down here again to add it, just like you do on any other screen. Choose a file. I've got some files in my test group here. So I'm going to pick destruction of records SOPs. I'll click on that. File chosen. And I'm going to upload it. So now you'll see the destruction of records. So I'm going to call this SOP1. I'm going to go ahead and change the light to green for now. I can say, let me put a date and time stamp. Updated last fiscal, whatever you want to put in there. And I'll go ahead and save that. So now we have the SOP document attached to that activity. Go back to the activity here. So what's going to happen as we go through the year, it says right now we're 55% of the way through the year. When we get to 90% of the way through the year, which would be around middle of March, I think, Jen is going to get an email from the system because the light's going to turn yellow and it's going to trigger the email. That email is going to say, Jen, you need to update this SOP. It's going to give her a link right into this activity. She can go into here. She can grab this. She can download this particular document by clicking on the PDF right here. Download the document, do the update on the document, upload the same document. It's got to be the same file name to do automatic version control here. So it'll upload the new version of SOP number 1 right up to here. When she's done with it, she's going to go back here. When she goes ahead and says save it, it's going to say, do you want to update the cycle start date? You go ahead and say select, and you'll make it, in this case, we'll say 7/1 of 25. We'll say okay. So what we've done now is updated the SOP, moved the cycle start date forward. So where this is really, really nice is if you have a bunch of policies, memos of understanding, standard operating procedures, grant documents, anything that you need to track and update over a period of time, you build a plan out. We typically call it critical documents. The first service would be policies. The second service might be SOPs. The third service might be MOUs. The fourth one, grant documents. Underneath that, you're going to say, hey, I'm going to update all the policies on a fiscal year basis. Then you get down to the activity level. You build an activity like this. You put the person who's responsible for it in there. You upload the document to it, and it manages itself over the course of the next year, 5 years, whatever you want to do in there. So that is the activity I wanted to show you here. Now, as I mentioned, there's going to be homework here. The homework is going to be really simple. I want everybody to log in, go down to the training group. You're going to go to services and initiatives. You're going to hit this button or this button. You're going to put in a service. It doesn't have to be business related. It can be fun. It could be, I'm planning a birthday. So let's say Billy's birthday is going to be my initiative. So Billy's my son. Underneath that, I'm going to put a goal. It says, have the best birthday party ever for Billy. It would be my goal. So that's a nice goal, right? And then I'm going to get down to the objectives, my SMART objectives. One of the objectives might be by the end of January, select the proper venue for Billy's birthday party. And then underneath that, I might have some activities like check with my neighbors to see what venues they've used for birthday parties. Check with Yelp to see what venues are available, that sort of thing. So different types of activities. So what I'd like each of you to do is when you put in your service or initiative, just make it as simple as you can, just like I did Billy's birthday. In parentheses after that, put in your initials. That way we'll know who did what all the way through. Put in the service or initiative. You can do one of those. You can do one goal. You can do one SMART objective. Then ideally, if you can think of the way to use the 3 different types of activities, project-based, QA, and QM activities, put one of each in there. Kind of think about the different types of things. You're measuring a quantity. You're doing something every month, maybe, something along that line. You're going to have about 6 planning elements in there. What we're going to do in the next session is we're actually going to go through and review everybody's plan. So get your plans in there. Again, we'll probably schedule it for about a week from now. to get the plans in there. We're going to go through everybody's plan. We're going to critique them. We're going to give you some ideas on how to make the plan a little bit more complete, maybe, or we're just going to say, hey, great plan that you've done in there. So I'd ask everybody to go through that, get your plans in there, and again, we'll review them during our next session here. So that is what I had to go through today. Oops. Are there any questions? Anything else I can show you? Okay, as I mentioned, this session has been recorded, so I will send Jen the link to the recording in here, and she can share it with all of you if anybody wants to go back through. Again, you've got all the slides in the documents attached to the meeting invitation. So if there's no other questions, I will let you all get back to your job for today. And if you do have any questions, here's my contact information. Please feel free to reach out to me. Thank you, everybody.
Thanks, Brad.